Greetings, and welcome back to PBH 275, Injury Prevention and Control. Today's module will cover two topics, ergonomics, which is covered by this video, and biomechanics, which is covered in a separate video from Dr. Jacob Gooden, with the link in your syllabus and the course module. This lecture on ergonomics was developed by borrowing extensively from the expertise of Dr. Mayur Karma, an occupational therapist with extensive knowledge of ergonomics for injury prevention. If you want to learn more about this topic, I would recommend looking up some of Dr. Karma's publications, essays, and videos. The objectives of today's module are the following. We're going to define the term ergonomics. We're going to identify ergonomic risk factors for injury. We're going to talk about the scope of the problem, as this is a problem that occurs in the workplace and also in the home. And then finally, we'll talk about some possible solutions for ergonomic problems in the workplace and at home. Let's start at the beginning. What does the word ergonomics actually mean? Well, the definition of ergonomics is dynamic. It doesn't necessarily mean the same thing now than it did a few decades ago. The original word ergonomics is Greek, and it comes from the Greek root words ergon and nomos. The literal English translation of those words would mean work rules or work principles. However, in the modern era, ergonomics is about a lot more than just rules for working safely. We have plenty of other words in the English language to cover that concept. The modern English language definition of ergonomics would be the art and science of optimally fitting a person to the task they are performing, whether it's a work task, a leisure task, a hobby task, whatever the case might be, trying to get that optimal fit between the person and the task to minimize the risk of injury. An alternate similar modern definition of ergonomics would be employing body physics principles to optimize function and minimize injury risk. A third alternate modern definition of ergonomics would be the actions that we take to prevent or mitigate specific musculoskeletal disorders. And don't worry, I'll define musculoskeletal disorders pretty soon. In the previous slide, I defined ergonomics as a noun and the modern definition of it. The word ergonomic has also been used as an adjective, often in conjunction with words such as injuries. We now speak in terms of ergonomic injuries. What that phrase ergonomic injuries means is a large variety of conditions that can be caused by repetition, overexertion, bodily reaction, awkward postures, vibration, many other conditions that we'll talk about in the ensuing slides. In the realm of occupational safety and health, both the U.S. Department of Labor, Occupational Safety and Health Administration, and the Bureau of Labor Statistics, the organization that assembles a lot of our safety and health data, they refer to a broad range of ergonomic-related workplace injuries as musculoskeletal disorders, or MSDs. That's what we're going to talk about next. Musculoskeletal disorders, or MSDs, can include a lot of different injury conditions. This is not an all-inclusive list, but it's a fairly broad and inclusive list. Pinched nerves, herniated discs. Discs are those little pancakes of cartilage that are present between several of the vertebrae in the spinal column. They can become herniated or pushed out from where they're supposed to be and start to bulge. And when they do that, they can impinge upon the many nerves that emanate from the spinal column, because of course in the middle of the spinal column is the spinal cord. Sprains. When we talk about sprains, we're talking about micro tears in connective tissue that connects bones to bones, which would be ligaments, or bones to muscles, which would be tendons. Sometimes those connective tissues can actually completely tear, and that's another type of musculoskeletal disorder, along with other types of herniations besides just discs. Carpal, cubital, and tarsal tunnel syndrome, or other MSDs. We'll talk later on about carpal and cubital tunnel. We'll also talk about Raynaud's phenomenon, or white finger syndrome, which is a vibration-induced syndrome, generally affects the hands and the fingertips of people who have been affected by that. Eye strain and eye fatigue are actually musculoskeletal disorders. You would think that they might be eye disorders, but whenever your eyes get fatigued, because, for example, you're reading in a low-light environment, what actually gets fatigued are the muscles that move the eyes, that drive the movement of not just the eyeball themselves, but also inside the eyeball, that drive the movement of the pupils and the iris. Those can get fatigued, and that's a musculoskeletal disorder. And any other type of musculoskeletal or connective tissue disease and disorder not previously covered in this slide. When we look at the risk factors for musculoskeletal disorders, they can be divided into 5 very broad but mostly inclusive categories of risk factors. We're going to talk about all 5 of these risk factors in more detail in the ensuing slides. The first risk factor is high task repetition and repetitive motions. Another is forceful exertions. This can be both overexertion, the classical example of where maybe you try to lift something or move something and it's heavier than you thought it would be, and you overexert and hurt a muscle, but also bodily reactions to loads, particularly when a load suddenly becomes more heavy because it's a dynamic load. This happens a lot in patient care settings where, let's say that you're working in one of these settings and you have to help a patient off of a table, an exam table, and into a wheelchair. And if the patient is semi-ambulatory and conscious, they can provide some assistance. You're not bearing their entire load, but then if the patient gets fatigued, suddenly they might not be able to assist, and now you're bearing all of their load. And so a lot of times when loads are dynamic and there's suddenly more that's expected of us and our body reacts to it in a certain way, that's another type of forceful exertion that often leads to a musculoskeletal disorder. Anytime we have repetitive or sustained awkward postures, and we're going to talk later on about what I mean when I say awkward postures, but also static postures. Anytime that our postures are frozen in place for too long, that can impede circulation and it can distress body systems. Excessive vibration and contact stress are 2 more major risk factors for musculoskeletal disorders. So let's start with the first category of risk factors, which is high task repetition. Anytime that we are doing a task with a cycle time of 30 seconds or less, that's considered high task repetition. In other words, you're doing something, and then within 30 seconds or less, you have to do it again. This happens a lot of time in assembly line situations in employment, and also in the manufacture of piece goods, where there's a lot of things going by and you have to do something to that over and over again. It tends to be the same joints and the same muscles that we're using over and over again, and that can lead to a musculoskeletal disorder. This can happen with any kind of repetition, even when there's not additional load, but when we also add high force or awkward postures to those high task repetitions, this is often how MSDs developed. If you're working on an assembly line and you're actually having to lift things off, so you're not only doing something repetitious, but also putting a lot of load on those muscles repetitiously, that's a risk factor. Awkward postures, we'll talk more about this in just a second, but our joints are designed so that there's a place where that's kind of like their optimal range of motion, that's where if they're moving within that range, they're generally fine. I mean, the tendons and ligaments are not too stressed. The nerves are not being impinged. Circulatory systems are not being impeded. So therefore, the tissue is getting the nutrients and the oxygen it needs. The waste materials are getting carried away the way they're supposed to. But if you push joints outside of that normal range of motion into more awkward postures in a sustained fashion, you can get, especially when you combine it with a lot of repetition, that's a risk factor for musculoskeletal disorder. 2 of the most common forms of high task repetition MSDs would be lateral epicondylitis, better known as tennis elbow, and medial epicondylitis, which is more commonly known as golfer's elbow. In both of these cases, you're doing a certain task very repetitiously, with your arms and bending your elbow. And what happens is that over time these elbow tendons become inflamed because of these repetitive motions of the arm and the wrist. And in particular, at the bones of the arm have these little bony stalks on the end of them that the tendons can eventually start rubbing against them and becoming inflamed and even developing micro tears. And then they get swollen, you kind of lose some of that range of motion, and you don't want to play tennis or play golf for a while because it hurts to go through those motions. Whenever you're doing very repetitious tasks too, another risk factor, it's not really a musculoskeletal disorder risk factor, but just a general injury risk factor, is that you stop paying attention because you're just doing something mindless, and it's boring, and you kind of check out, and so you might become at risk for other types of injuries because you're not paying attention to your task. The next major category of risk factors for MSDs are forceful exertions. The first category of this would mean lifting or moving objects, which places a high force load on the musculoskeletal system. Particularly when we lift objects. You can lift an object that's, say, 30 pounds, and depending on where you're holding it, there can be a force multiplier effect where certain parts of your musculoskeletal system will have forces on them that exceed 30 pounds. Overexertion can occur when we have a sudden change in force, like I talked about before, with assisting with patient handling, when we underestimate the amount of force needed to move an object or to lift an object, or our muscles could just get fatigued when we're moving or lifting an object, and then we either drop something, and that can be its own risk factor for injury, or we strain to keep something up and try to recruit more muscles, and that can sometimes lead to micro tears and other musculoskeletal injuries. When we're not careful about lifting or moving objects too, we can put a lot of force on sensitive body systems, such as the vertebral discs. When we lift an object, again, like I said, there's a force multiplier, and a lot of times those forces multiply in places that we really don't want them to be. If you've ever worked in a situation where you have to lift objects, you've probably been told, lift with your legs, not your back. There's a reason for that. The muscles in our legs are designed to hold up a lot of weight. They hold up our entire person weight when we walk and run and get out of bed and do everything else. They're very powerful muscles. They, if you give them enough time and training and stretch them before you can actually, they can lift a pretty good amount of weight. In our back, however, those muscles are not really designed for lifting. Those muscles in our lower back are designed for supporting and protecting our spine. When we try to lift with our back, like you bend over to pick something up, those muscles, first of all, they're not particularly strong compared to our leg muscles, but then also that force multiplier that I talked about before puts a lot of that force load on our vertebral disc, particularly in the lumbar region. This is where a lot of herniations and lower back injuries occur. There are some other tasks that we perform that can place a high force load on the human body. For example, if we're using hand tools to hammer or drill or cut, say we're using a hammer or a drill or a saw, of course we have to generate a lot of force in order to drive that nail in with the hammer, or to get that drill bit through whatever it is that we're trying to drill, or to get the saw through the board or whatever it is that we're cutting. So we have to exert a lot of force in order to make those things happen. But then there's often some recoil forces, particularly with things such as hammering and drilling, where you hit the nail with the hammer and you feel a force coming back into your arms and your wrists. And that's natural. Again, that's a reaction force. What often happens is that because we don't want the hammer to kick back, or we want the drill to keep moving forward, we will greatly increase our muscle effort in response to these reaction forces, and then that can fatigue our muscles very quickly and lead to musculoskeletal disorders. So anytime that you're doing any kind of manual labor with a tool that involves a lot of force being exerted and a lot of mechanical force being generated, there's a risk for muscle fatigue and musculoskeletal disorders if it's not done right, and even sometimes when it is done right. The next major category of risk factors are repetitive and/or sustained awkward postures. As I said before, joints are the most efficient when they're operating near the middle of their motion range. That's where, metabolism and nerve conduction and just overall function and avoiding a lot of strain on tendons and ligaments. That's generally joints work best in the middle of their range. The risk for MSDs increases as you put joints outside of their mid-range for prolonged periods of time, either sustained, meaning you hold them in those awkward postures, or repetitively, meaning you put them in the awkward postures, but then you take them out, but then put them back in again. If you want a good example of how when we get our joints outside of their mid-range, how quickly pain and discomfort can set in, I would challenge you right now to go ahead and put your arms over your head. For those of you that are fans of American football, imagine that you're a referee signaling a field goal attempt that's good. And you've got your hands up above, your shoulder joints are now at the upper range of their motion. Now this is something you can do periodically if you need to reach for something, but those joints in your shoulder are not designed to be kept in that posture for very long. If you keep your hands up and your arms up for a long period of time, you start to get numbness and tingling. And again, that's because nerve impingement is happening, because circulation is being affected, because joints and tendons in the joint are being stretched a little bit farther than they're comfortable being stretched. And so this is something that happens in a lot of hobbies and in a lot of workplace settings. We get into awkward postures which overload the muscles and tendons around the joint. We also sometimes get involved in static postures that impede circulation. Here at the bottom we have this diagram of, again, these are examples of a person using a cordless drill tool in order to drill a hole. And in the first picture, you see that the shoulder joint is at a comfortable posture. The elbow joint's at about 90 degrees, which is, again, that's a pretty good angle for the elbow joint. It's generally pretty comfortable there. The joints, the nerves, the blood vessels are in pretty good shape. So you can hold that posture and you can do that task for quite a while. Now, with that being said, like with any other task, eventually you need to stop and rest so that you can, so that you don't fatigue the muscles. The next picture, as you can see, the shoulder and the elbow angles are getting a little bit less ideal, but still, that's a posture that can generally work for short periods of time. In the next image, the one that has the yellow check beside it, in this case, the drilling is taking place overhead. And so the elbow is still not at a bad angle, but the shoulder joint is getting sort of out of its neutral preferred posture. So you can drill like that, but it wouldn't be a real comfortable thing to do. And in the final picture, the one that's got the orange X, in this case, overhead drilling is occurring, the elbow joint is locked, and the shoulder joint is pretty severely turned up. Our joints, when I said they have a sort of a middle of their motion range is where they're most efficient, yeah, that means that they should usually be slightly bent. If you lock a joint, that's usually not the most efficient way of having it, and that can create, again, impingements, circulatory problems. So this is definitely overhead drilling, like you see in number 4 there on the right. That would be something that it would hurt after a very short time. There's another repetitive and sustained awkward posture that many of us do, and it's something that we need to be made mindful of, and that's awkward postures of the neck, specifically the part of the neck that holds up our head, which is the cervical vertebrae of the neck. The average human head weighs about 5 kilograms or 11 pounds, but again, the relative force exerted on the neck and spine increases as you move the head forward. Again, it's another one of those force multiplier effects, where if your head is at 0 degrees, meaning you have a nice, proper, upright posture, then the only force that your head is exerting on your neck is just its regular weight, 12 pounds, 11 pounds, whatever the case might be. But as you can see from the diagram, as you tilt your head forward 15 degrees, that weight suddenly becomes 27 pounds on the cervical vertebrae of the neck. And as you tilt your head even farther, like 60 degrees, it becomes a 60-pound force. So you can see very quickly, hanging your head can create a lot of force on the very delicate cervical vertebrae of your neck, and it doesn't take long sometimes for pain to emerge from that. This is a modern phenomenon we call texting neck, and it's something that I think all of us have done at some point or another. Whenever we're reading our phones, our tendency is to look down at it while we're reading it. And by doing so, we're force multiplying the weight of our head onto the cervical vertebrae of our neck. The reason why we do this is because if we were to lift our phone or tablet or whatever device we're reading up to where our head is at 0 degrees and therefore our neck is relaxed, well then now we're having to put our shoulder and elbow joints at maybe a less than comfortable posture. So reading a phone or a tablet or other device, it's a little bit tricky sometimes. We need to make sure that whatever postures we're in, that we are dynamic with them, that we change them up, that we don't let our heads hang, and that we just maybe moderate our usage of these devices for this reason. The next major risk factor category is excessive vibration. We'll start with hand-arm vibration because this is something that we encounter a lot in the usage of common everyday tools and also in some less commonly used tools, especially in the construction industry where we use things such as jackhammers. Whenever our hands and arms get vibrated a lot because of tool usage or anything else that we're doing, that can damage and affect peripheral nerves and blood vessels in the fingers, hand, and wrist. The peripheral nerves and blood vessels at the tips of our fingers are particularly sensitive because, if you remember this from physiology classes you might have taken, they get really, really small when you get toward the very edges of fingertips. This makes it, so that as force gets into those tiny nerves and tiny blood vessels, it can create more damage than it might on some of the sturdier ones. They're closer to the spinal column. So what happens as these nerves and blood vessels become damaged due to excessive vibration is that people start to lose their sense of dexterity and their sensation in their fingertips. But if you get a lot of vibration to the wrists, you can actually start to have your grip affected as well, where suddenly your grip force is not as strong as it used to be. And if you don't feel things as well, it's harder to pick up and hold things sturdily. Another phenomenon that happens with a lot of hand-arm vibration is what's called Raynaud's phenomenon, also known as white finger syndrome. You can kind of see a picture of what this looks like on the right, and this transcends, ethnic and racial groups, and it doesn't matter relative pigmentation of skin. This is a phenomenon that can happen to anybody who's exposed to a lot of hand-arm vibration, and where you get this blanching of the skin, particularly in cold weather, because the nerves and the blood vessels in the extremities start to close up in response to this cold stimuli, and then these fingers, basically you can't use them for much. They're all their sense of sensation is gone, and that's again Raynaud's phenomenon develops with a lot of people that operate jackhammers develop this as a musculoskeletal disorder. Excessive hand-arm vibration is also a risk factor for carpal tunnel syndrome, which we're going to cover shortly. Excessive vibration can also be a problem when we have whole body vibration. If you're wondering about a situation when this can happen, imagine that you're driving in a truck across some gravelly desert roads and you're getting continuously shaken, which happens to a lot of people who work in the energy sector and many other places. You might be in a situation where you're in a vehicle or some other thing where you're continuously being shaken. Well, that whole body vibration can damage and affect the lower back, particularly the lumbar vertebra, the ones that are also susceptible to injury when we bend over to pick up heavy things. Well, it can also be damaged by excessive whole body vibration. Research from Patterson and colleagues shows that when we're in a situation like this, where our whole body is being vibrated, our spines are undergoing a lot of forces. They undergo compressive forces, rotational forces, flexion, and tension. And these are things that, again, we don't want our spine exposed to these because our spine is a very delicate part of our body systems. It contains our spinal cord. And many of the nerves of our body radiate from that. So whenever we get this lower back pain from excessive vibration, sometimes that pain will just stay in the lower back region where some of the root nerves coming out are not being affected. That's called lumbago. That can be a painful condition. But what's far worse, which can happen sometimes with whole body vibration, is that you will get sciatica. This means that you get a pain that radiates from the lower back down the path of the sciatic nerve, which goes from the lower lumbar vertebra all the way down the legs to the ankles. And it can be a really shooting pain. It can be debilitating. It can make it hard to walk, can make it hard to do just about anything. And again, that happens when we have whole body vibration or some other insult that injures the lumbar vertebra. Maybe you get a herniation of one of the discs that comes out and starts rubbing against one of the nerves, like the sciatic nerve. So yeah, this whole body vibration can create a lot of pain far downstream. The final major category of risk factors for musculoskeletal disorders is contact stress, or stress upon contact. This happens whenever forces are concentrated on a small area of the body, and that includes body weight forces. If you're like sitting at a hard wooden table and you put your head in your arms, and therefore your head weight is being put down on your elbows, and your elbows are being driven in the table, it doesn't take very long for that to become uncomfortable. Basically, any time that we press soft tissues against hard surfaces, especially when we put some of our own body weight behind it, that creates contact stress. Contact stress results in inflammation, and also what's happening with contact stress is that we're restricting oxygen and nutrient flow to tissues, and the elimination of wastes that are being built up in tissues. You can develop vascular or neural damage even if you're below the discomfort of pain threshold. If you're resting your wrists against the hard surface of a desk while you're typing, you don't have like a gel pad there, you can be damaging your circulatory and neural systems even before you become uncomfortable. So examples of contact stress would be anytime we rest our wrists, hands, elbows, or knees on hard surfaces for long periods of time. If you're to kneel down onto a hard tile floor, for example, it will not take too long before your knees will start to hurt because, again, they're being driven down into this hard surface by our body weight. It's not designed to do that for long periods of time. Anytime we rest our wrists, hands, or elbows on hard surfaces, again, it could be desktops or anything else for too long. It doesn't take very long before pain results. Contact stress is a risk factor for both carpal tunnel and cubital tunnel syndromes, which I'm going to talk about in the next slide. Contact stress also occurs during prolonged sitting. If you ever sit in a chair for very long, particularly if it's not a very soft chair, if it's kind of got a hard cushion or even like a metal chair, it does not take very long before you develop soreness on the back of your legs because, again, you're pressing down body weight onto that part of your body that's pressed up against the metal chair or whatever kind of hard chair it is. This can also be forces that are generated in our lumbar discs or in the lower vertebral column, sacrum and coccyx. This is why it is so incredibly important to not sit for prolonged periods of time. We need to get up and make sure that we do dynamic things so that we don't get buildup of wastes and poor circulation and poor innervation in some of these areas. So now let's talk about a very common ergonomic injury, carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve of the wrist becomes irritated. Now the median nerve, it innervates our thumb and their middle two fingers and the inner half of the ring finger. The median nerve passes through what's called the carpal tunnel. this little tunnel in the wrist that also contains and blood vessels and tendons. And there's a carpal ligament that goes over that actually kind of forms the tunnel. Well, anytime that we rest our wrists on a hard surface for too long, or we engage in what's called ulnar deviation, meaning that we bend our hands outward a little bit, as often happens when people are using a conventional keyboard and their arms are at an awkward angle, so they have to kind of bend their wrists in order to put their fingertips in the correct position on the keyboard. What happens when you do that is that the median nerve inside the carpal tunnel starts to get irritated. It doesn't like that movement. Symptoms of carpal tunnel syndrome include pain, tingling, or numbness in the thumb, index, and middle fingers, and the inner half of the ring finger. Again, those are the fingers that are actually innervated by the median nerve. You also can develop weakness. The reduced function of the thumb pinching muscles mean that as carpal tunnel syndrome progresses, your thumbs are just not as strong. You can't generate that pinching and squeeze force that you sometimes need for other routine tasks. So it can be debilitating. Another common ergonomic injury is cubital tunnel syndrome. In this case, the ulnar nerve is the one that gets irritated, and as it becomes more irritated and inflamed, we start to get tingling and numbness and loss of function. But in this case, it happens on the inside of the elbow, so therefore it's the outside half of the ring finger and the pinky finger where we start to feel pain, tingling, and numbness, along with on the inside of the elbow. Cubital tunnel syndrome can be due to resting our elbows on hard surfaces for long periods of time. That's a very common risk factor. If you've ever done that, you've probably noticed that, one and a half of your fingers on each hand start to tingle. Also, if we have a traumatic blow to the elbow or the humerus, which is commonly known as the funny bone, whenever that happens and you get that shooting pain up your arm into your pinky and outer ring finger, it's actually because the ulnar nerve is being impacted and injured. I talked earlier about how contact stress from prolonged sitting can cause irritation of the muscles of the legs and also can be bad for the lumbar discs of the back. But this graphic from the India Times kind of shows you that prolonged sitting, which since a lot of people have white-collar jobs now, is kind of a modern workplace problem, all the different ways that prolonged sitting can harm us. And some of these probably have a little bit more of an evidence base than others, but regardless, prolonged sitting is really not good for us. Like it shows with the legs, you can have fluid collect in your legs when you don't move them for long periods of time, especially when they also have contact stress from sitting against the cushion. And it's really, really important to sort of get up periodically so that this fluid buildup does not occur. It talks about the back, about the compression of the spinal discs that can happen. This is something that actually does happen periodically in workplaces and other places where people sit for too long. In the head, when you sit for long periods of time, blood clots can form, which can travel to the brain upon sudden movements and lead to strokes. So I'll give you a second to kind of look over all of these. Again, these are all examples of why a few years ago in public health, somebody tried to promote the idea that sitting is the new smoking, meaning it's the new thing that we do way too much of that's harming us in ways that we don't know. And while that might have been slightly exaggerated and overblown, these risk factors are, most of them, if you look, you can find evidence-based that yes, all of these risk factors are increased for people that sit too much. Now let's dive into the question about how big of a problem are ergonomic injuries. First thing that I need to acknowledge is that unlike a lot of the other injuries that we've talked about in this injury prevention and control course, people don't really die from ergonomic injuries. It's not like fall injuries or gunshot injuries or many of the other types of injuries we talked about. But what that means is that ergonomic injuries tend to be underreported because, again, people don't die from them. Plus, a lot of times they manifest outside of the work environment so that, if you develop an ergonomic injury because of your weekend hobbies, a lot of times people, they won't go to the doctor for that. They'll just treat it on their own, or they certainly won't tell their employer about it, and so therefore it doesn't get counted in the official OSHA, BLS statistics of what's injuring people. But even if they don't cause death, ergonomic injuries can ruin people's quality of life. It can take away the joy from jobs that people enjoy doing or hobbies that they enjoy as well. So they're a big problem, even if you won't see them on the cause of injury death WSCARS charts that we've shown you throughout this course. If we want to look at WSCARS to try to calculate how big of a problem ergonomic injuries are, well, there's really not a lot of data available. Basically, the only category in WSCARS that's really applicable to what we consider to be ergonomic injuries would be non-fatal overexertion injuries. And if we look at the year 2019, the cost of injury data, non-fatal overexertion injuries were very costly. They were almost $6 billion in hospitalization costs and over $62 billion in people who were treated in emergency departments and released. So a lot of overexertion injuries on the job did occur in the US in the year 2019. By necessity, most of our data on ergonomic injuries comes from the workplace. There's just not really a good way in the US to track the ergonomic injuries that people suffer or that manifest themselves outside of the working environment. For the people that suffer ergonomic injuries because of hobbies or tasks outside of the employment. But within the workplace, ergonomic injuries are a huge problem. If we look at the leading causes of non-fatal workplace injuries and illnesses that resulted in days away from work in the year 2019, what we see here is these are the top 15 non-fatal workplace injuries or illnesses that resulted in days away from work. The number one cause of this was musculoskeletal disorders. And you can see that most of the musculoskeletal disorders, the red bar represents the fact that these did not involve any kind of medical treatment, but still an injury was suffered and it impacted somebody's quality of life. It caused them to miss some days from work. The tiny little light blue bar are inpatient overnight hospitalizations. In other words, somebody had to get admitted to the hospital because their, in this case, musculoskeletal disorder injury was bad enough to warrant that. And then the darker blue bar means emergency room visits only. So, and the little gold at the tip is the total number of cases. As you can see, what we might classify as ergonomic injuries were the number 1, number 4, and number 12 leading causes of injuries that resulted in days away from work. Number 1 being musculoskeletal disorders, number 2 being various types of overexertion, particularly in lifting, which is a type of musculoskeletal disorder, but it's just one that had its own classification category. And then down at number 12 are repetitive motions involving microtasks, which is definitely what we considered an ergonomic injury, or certainly ergonomic risk factor. Along with the official government data that comes from the Bureau of Labor Statistics that often gets fed into the WSCARS system through CDC, another interesting source of data on workplace injuries is the insurance industry. In this case, Liberty Mutual publishes a workplace safety index every year from their risk control services that talks about what are the total costs of disabling workplace injuries and what were the costs of the top 10 most disabling workplace injuries. In this case, you might notice that of the 10 most disabling workplace injuries, 3 of them are ergonomic. Number 1, the most expensive workplace injury per Liberty Mutual is overexertions involving outside sources, like handling or lifting an object. That was 22.7% of all disabling workplace injuries, representing a cost of, well, I can't really see that, like 13.3 billion, I think it says. The number 5 most costly workplace injury category was other exertions or bodily reactions, such as awkward postures. And number 10 was repetitive motions involving microtasks. So, As you can see, the private insurance industry as well also tracks this data and uses it to figure out how much they're going to have to pay out in claims. And everybody, both insurers and workplaces, and really all of us that care about safety and health and well-being, all want people to suffer less of these ergonomic injuries. What can be done about these ergonomic injuries? Well, the good thing is the same control measures that we applied to so many of these other injury topics that we've covered in this semester are also quite useful for ergonomic injury prevention. We can start with environmental changes and then kind of work our way down the hierarchy of controls, or sort of going from upstream to downstream, whatever your preferred framing is. But we can start with environmental changes. We can introduce engineering and work practice controls. Job and task rotation is a type of control that we haven't really talked about very much in any other injury topics, because for a lot of other injury issues, it doesn't necessarily make sense to have ever more people experience the injury, but to a lesser extent, which is really what you're talking about with job and task rotation. But as we'll discuss in just a little bit, there's a way that it makes sense for certain types of ergonomic injuries. Personal protective equipment, and then there's some things we can do to sort of make ourselves less vulnerable to injury, such as taking frequent rest, stretch, and recovery breaks. And then finally, high-quality medical care and rehabilitation is always going to be necessary, because people have different susceptibilities. There are some people who can get a severe musculoskeletal disorder after only a few days at certain tasks, whereas some people can do them for years and never be impacted. So, while upstream is always going to be preferred, quality medical care and rehabilitation services are also necessary, because part of what ergonomic injuries do is they take away people's ability to do things that they enjoy doing. And if we can give them some of that back, that can greatly improve quality of life. Let's start at the very top, changing the environment. You remember a few weeks ago I talked about the 4 E's of injury prevention, how changing the environment is really a separate thing from engineering controls, and certainly a different thing from enforcement and education. We need to consider whether certain tasks need to be performed by humans at all. There might just not be any way for a human to do the task without it causing wear and tear on joints and other delicate body systems. And in that case, well, a lot of times we think of automation as a bad thing because it costs us jobs. There are some jobs that really, honestly, probably need to be automated if we're thinking about the safety and health and well-being of the population as a whole, and certainly of the individuals who might get stuck performing these tasks. I mean, there are certain things where it might just make more sense to have a robot do the job than to have humans do the job, who just, there's just being no way to, if there's no way to feasibly engineer out the hazards of that particular job. Now, outside of the work environment, there are some voluntary tasks that many of us do because we enjoy them, but they have some ergonomic risk factors. Think about, for example, gaming or gardening. For these types of voluntary tasks, we can change the environment by limiting the number of hours that we do these at a given time, which, when you're really locked into a game or really on a roll in the garden, it's kind of hard to limit your hours, but we really need to, because our bodies are not designed to do that thing for that many hours in a row. Taking frequent breaks as well is important. Don't forget to upgrade equipment as needed. For example, if you're a gamer, you might need to upgrade your controls periodically, because after a while they sometimes get to a place where you have to press down harder on the control buttons to make them work because they lose sensitivity. Well, by doing that, you're putting more stress on you. So, it's okay to change out and invest in better equipment periodically, not just for gaming, but also for gardening. The sharper tools you have, the better gamer controls you have, the less force is going to be required from you to activate that. So this is an important environmental change we need to always keep in mind with those things that we do that are voluntary tasks and things that we love, that we spend a lot of hours doing. Upgrade as needed. As I've emphasized many times throughout the course of this semester and this course, engineering controls are good. They involve improvement through design, where now you're made something safer through design. You've kind of separated the person from the hazard. But they're not quite at the very top of the hierarchy of controls, just because in a lot of cases the hazard still is in the environment. But still, engineering controls are great, and some examples of engineering controls that can reduce or even eliminate ergonomic hazards include making adjustments to equipment and workstations so that our vulnerable joints stay in the optimal mid-range of motion during tasks. You can kind of see there on the lower left an example of, like, there's a task where somebody's having to bend at the hips and waist in order to do it. In this case, to like get I guess it's like maybe it's a wrap or something they have to like unfurl from a roll in order to put on something. Whereas in the picture beside it, the body is upright in a neutral posture, and they can get that wrap in a much easier fashion. We can use assistive devices that reduce the forces that we have to exert, like lifting forces, exertion forces, vibration forces. There you have an example of a Hoyer lift being used to lower a patient, in this case, into a wheelchair. And that, again, that reduces the force that the caregiver has to exert in moving the person from, say, an examination table into a wheelchair. I hope that those of you that have home office setups have some kind of shock absorbing surfaces to reduce contact stress on your elbows and your wrists. These gel pads that you see here that go in front of the keyboard and in front of the mouse. I mean, that gives your wrist and your elbows and your forearms something soft and cushioned to rest on rather than a hard surface, and that can greatly reduce contact stresses. So these are some examples of engineering controls. Work practice controls change the way that we do a task so that we do it safer. It involves procedures and it involves training. Again, the hazard is probably still there, but we've just learned a certain procedure and certain levels of training and equipment that help us to do it safer. An example of a work practice control in an occupational setting, but you can do this really in home settings too, it's probably important, where when you have a load that exceeds a certain weight threshold, like for example 50 pounds, it has to be team lifted. In other words, one person is not responsible for lifting and moving that. And this is an example of, you see this a lot in industrial locations where there'll be caution signs warning you that because lower back injuries from overexertion and lifting too much are so costly to employers, a lot of employers have implemented team lifting policies where above a certain threshold you have to get a buddy to help you. There can also be, again, we talked about engineering controls in the last slide, but engineering controls sometimes have to be mandated, and then it becomes a work practice control where before you lift something you have to put on this exoskeleton that will help you, that will sort of give you some assisting on that lift, or you have to use a Hoyer lift before in order to those engineering controls I talked about before, they don't work if people don't use them because it takes longer or it's inconvenient. And if it does take longer and it's inconvenient, you have to make sure that your work practice controls are very strict, that no, it doesn't matter if it takes longer. We want you using this. It's better for you, it's better for us, it's better for, in the case of like a Hoyer lift, it's better for the patient. We're not going to put pressure on you to do something quicker and bypass the engineering controls. In fact, we're going to mandate you use them. And the proper use and maintenance of tools and accessories. Again, if you've got tools and accessories that are designed to sort of absorb some of the shock, that are designed to be used at a certain angle so that they work, that they don't put your joints in an awkward posture, I mean, that's great, but they have to be properly used and properly maintained. And that goes into the realm of work practice controls. So really, in a lot of situations, engineering controls, I know I talked about them back in the motor vehicle lecture about them being passive and automatic. But in a lot of cases, engineering controls have to be put in place with work practice controls in a work environment so that people don't bypass them in the interest of doing it faster. So now let's talk about job or task rotation. This is something that hasn't really come up before this point in the semester. And this is the concept of where you limit the total consecutive time periods that any one person is exposed to the musculoskeletal disorder risk factors. What this means is in an employment situation, you have employees rotating between job tasks that use different muscle groups. This is also known as job task enlargement, where people are doing more dynamic things over the course of a day, rather than having one person doing this, and the other person doing this and only this. This helps everybody. A really good work practice, again, this is a work practice, but also a job task rotation response, is to have what's called floaters, people in a workplace environment who can provide periodic breaks, for people between their scheduled breaks, so that nobody is doing a particular task for very many minutes at a time. And this idea is that, like floaters and rotating between tasks, this can apply outside the workplace as well. Taking periodic breaks to do something different in the middle of your gardening or your gaming or whatever it is that you're doing can make you so much healthier and can enable you to do that thing that you love for longer. Personal protective equipment, or PPE, also has an important role in the prevention of ergonomic injuries. Now, if you remember back to the occupational injuries lecture, when I talked about the hierarchy of controls, PPE was at the bottom. And the reason it's at the bottom is because you're talking about something that the worker or the hobbyist, if we're outside the work environment, has to put on and use correctly in order to be protected. The hazard is still there, it's just we're putting on something on ourselves to protect us from it. So it's good, but it's at the bottom of the hierarchy. So some examples of PPE would be earplugs, shock absorbing or padded gloves and sleeves. This can enable people to use a drill or a jackhammer or many other things without absorbing nearly as much of the vibration forces as they would without them. We know that for people that use keyboards a lot, that wrist and arm braces can prevent radial and ulnar deviation. Ulnar deviation is particularly common in people who type on a keyboard because you sometimes have to bend your wrists outward a little bit to get them flush on the keyboard, and that can hurt the carpal tunnel and many other areas of the hands and arms. Another PPE would be, you might have seen the split QWERTY keyboards, where people don't have to deviate their hands in order to use this keyboard. That would be another example. One very common form of PPE that's seen a lot, particularly in warehouse environments where people have to lift, is back belts. Now, a word of warning about back belts. The Occupational Safety and Health Administration and NIOSH, the National Institute for Occupational Safety and Health, have done a lot of research on back belts. They don't really prevent lower back injuries. A back belt does not make you superhuman, does not make you able to lift things that you would not be able to lift if you didn't have it. Back belts, however, do have one useful purpose to them. If a person is wearing a back belt, it provides a visual and tactile reminder to the person, like the warehouse worker, for example, not to bend at the waist when lifting. It actually makes it harder for somebody to bend at the waist and lift in an incorrect way that's going to put force on their lower back. Now, if somebody tries to do that and lift anyway, the back belt doesn't really provide any protection, but it does provide a nice visual and tactile reminder not to bend at the waist in order to lift. So in that way, back belts do have somewhat of a use in a warehouse or other industrial environments. Taking frequent rest, stretch, and recovery breaks is critical to avoid ergonomic injuries because this provides an opportunity to counteract any of the sustained awkward postures, muscle loading, and other risk factors for ergonomic injuries. And it allows for recovery time of muscles and soft tissues. It gives them a chance to get recirculated and re-innervated and just kind of toxins removed, and it just helps everything. It helps tendons and ligaments to have a rest as well. It improves circulation and flexibility when you do stretches particularly. And the little diagram here shows some common stretches you can do in an office setting. Kicking the leg up, using the chair, doing the overhead stretches. If you're going to be doing a lot of data entry or something like that, you need to get up periodically anyway, but it's also good to do some of these stretching and recovery breaks like you see here, and do those stretches. If you do this, if you give yourself frequent breaks, frequent stretching, frequent recovery breaks, that increases the likelihood that you can keep doing this activity into the future. that you won't reach a point in life where suddenly you can't do it anymore because it hurts so much. The availability of quality medical care and rehabilitation is also invaluable in helping people to recover from ergonomic injuries and get some of their function back. Now, obviously, this is a tertiary control, that by the time you get to this, it means the injurious event has already occurred. But it's still very important. I mean, you can alleviate a lot of pain, and the sad truth is that a lot of times it's ergonomic injuries that cause chronic pain that often send people in the direction of opioid addictions, and that can sometimes destroy lives and even end lives. We can also get a lot of function back. A good example of this would be that for people that have carpal tunnel syndrome, where wrist braces and other things haven't worked, you can actually have a surgery to have the carpal ligament doesn't really serve any physiological purpose. It can be cut, and when it's cut, that relieves pressure in the median nerve. And a lot of times people find that along with some rehabilitation exercises that, carpal ligament transection surgery actually resolves their carpal tunnel syndrome. I mean, yes, obviously it would have been better if that never developed in the first place, but still, this can give people a lot of their life back and reduce a lot of pain. Generally, a successful rehabilitation requires removing the risk factors from the patient's life, however. In other words, you might not be able to do exactly the same things you did before. If you have if you get a severe lower back injury, like a severe herniated disc where the disc has to be replaced with an artificial disc, or you have to have disc fusion surgery, more than likely for several months to years afterwards, you're going to be under lifting restrictions because they don't want that area of surgery to have any force whatsoever put on it. Also, I mean, once you've recovered from carpal tunnel or tennis elbow, you might have to avoid contact stresses or repetitive motions that triggered those carpal tunnel or tennis elbow and other injuries in the first place. So, successful rehabilitation might have to come with some restrictions or modifications to the behaviors that were risk factors for the injury in the first place. And that's just something that there's often not much that can be done about that. You want to avoid getting a lower back injury if you don't have one now. They are very painful because, again, there's a lot of nerves that come out of the lumbar vertebral region that can be impacted by herniation of those discs. The best way to prevent lower back injuries, if you're going to lift something, always test the load before you commit to a lift. Don't get surprised. If you sort of gently nudge it and it won't move, then it's probably something that you shouldn't be lifting by yourself. And then, of course, once you commit to a lift, once you figure out that it's something that you can lift, use your knees, bend at your knees, keep your waist straight, use your powerful leg muscles for lifting power, not your lower back muscles. Don't bend over. The muscles of the lower back, remember, they're intended for supporting the spinal column. They're not intended for load lifting. Please, please always remember, lift with your knees, not your back. As we get near the end here, I want to talk about office ergonomics. This is very important because if you're listening to this, you're an undergraduate and taking PBH 275, so you probably have a lot of other tests that involve being at a workstation in order to write papers and do research and things like that. Many people also have jobs that are what we consider white-collar jobs, where you're doing data entry or other things that involve a workstation like you see here. I'm going to start with some office ergonomic tips for people who have a traditional office or home environment, where you've got a PC, maybe a tower PC unit, you've got a monitor, you've got a keyboard, sort of the traditional environment. In that case, some prevention strategies to keep in mind, and the graphic on the left here is courtesy of the Auburn University Risk Management and Safety Department. You see that the ideal sitting posture involves being upright, having your head over your shoulders, not leaning forward, because as we talked about before, the more you lean your head forward, the heavier it gets on your neck. You want to have the monitor at about where the top of the monitor is about at eye height, maybe a little bit lower than that. You want to have your wrists in a neutral upright position. You want to have your feet comfortably resting on the floor, or if you cannot do that, you want to have them resting on a footrest. Some additional items that are not necessarily covered in this graphic that I think are important is that, again, keep the top of the monitor near eye height. Make sure that if you're sitting at a desk that your knees and thighs actually clear under the desk without any contact. You don't want the knees or the thighs to be contacting the underside of the desk because, again, that's a contact stress. That's going to impede circulation and innervation of your legs from that point on. You want this chair seat edge to not contact the back of knee. Again, you want to have a little bit of clearance, like maybe about a fist of clearance between the back of your knee and the front of the chair seat. Because again, if the chair seat is digging into the back of your knee, that's a contact stress. You want to use gel pads to prevent your wrist from resting on hard surfaces, when you're using the keyboard and the mouse. And of course, get up frequently. Prolonged sitting is not good for us. One of your assigned readings in this week's module was the Home Office and Remote Work Ergonomics Tips from the UC Santa Cruz Environmental Health and Safety Office. The reason why I assigned this guidance is because many of you might not have traditional workstations. Among undergraduates, there's a very high prevalence of laptops and tablet computers. And these are great, they're portable, that you can take your computer a lot of different places you can't necessarily do with the traditional tower PC. The problem with these is that they often don't come with docking stations, or they might not have sufficient number of USB ports so that you can attach peripherals. Peripherals have to be attached either directly by a cord, or sometimes, if they're Bluetooth peripherals, you have to have a USB port for the dongle that broadcasts the Bluetooth signal back and forth. And if you don't have peripherals, it gets difficult to use these properly because you can't get the ideal distance between the screen and the keyboard on a conventional hinged laptop. What happens is you're either going to have if the keyboard has to be attached to the laptop, again for a conventional hinged one that doesn't have the removable screen, you're going to have poor head and neck posture, or you're going to have poor hand and wrist posture. In other words, the monitor is either going to be at the correct proper ergonomic height, but then the keyboard is too high, or the keyboard will be down at the proper ergonomic distance, but then the monitor will be too low. So in recognition of these issues, that's where this UC Santa Cruz EH&S ergonomics guidance comes in. Ideally, if you're using a laptop, you will have either a docking station or an adequate number of USB ports so that you can attach peripherals that enable you to get the proper separation between the monitor and the keyboard and mouse. Here's a couple of examples of how you should do this. On the left, you see the student is in a seated posture. They have a peripheral keyboard, and as a result of this, they can put the laptop a little bit higher, where the keyboard that comes on the laptop is no longer in use and is not needed, and so the whole thing goes up a little higher, so the monitor is at the proper height, while the keyboard is also at the proper distance, in this case the peripheral keyboard. On the right is a standing example where, again, it's the same idea. The monitor is put up to the proper height at eye level, whereas the keyboard, in this case a peripheral keyboard, is down at a place where when you're standing, your shoulders can be relaxed, your elbows are at the more or less a 90-degree angle, your wrists are straight and comfortable, and this is why a peripheral keyboard is often such an important thing to have if you have a laptop. If you have any way of accommodating it via a docking station or giving up a precious USB port for a peripheral keyboard, it's very important to try to do this. Here are some other ways that you can use your laptop, some good ways and some not so good ways. We'll start on the left. This is how a lot of students often use their laptops. They'll have it literally sitting on their lap, they're looking down at it and using it. And in this case, yeah, the student, their arm posture is pretty good. Their wrists are not bent too far. Their shoulders look relaxed, but the head and neck posture is very bad in this case. And as we talked about earlier, that's a force multiplier. The The more you lean your head forward, the heavier it gets, and the more pressure gets put on your cervical vertebra. So this is not sustainable for very long periods of time. You will start to get neck pain after a very short period of time using a laptop this way. So in the next picture over, okay, the laptop is now sitting on a table. So it's up a little higher, so it's still not quite, the monitor is still not quite at the perfect height, but it's a little bit closer. She's not having to bend her head down as much, put as much pressure on her neck. But look at the arms and the wrists. She's having to put her arms way up in order to reach the keyboard, and that is going to put an unsustainable amount of pressure on the shoulders and on the wrists. The elbows are relatively unsupported as well, so there will be fatigue that happens very quickly. You might also notice that there's ulnar deviation occurring of the wrists. She's having to kind of bend her wrists outward a little bit in order to type on the keyboard. So again, the arm and wrist posture in example number 2 here is not very good and not very sustainable. In the example picture you see in the middle, it's getting slightly better. In this case, what the student is doing is they actually have a pad that's sitting into the lumbar curve of their back so that they're getting some natural support of their lumbar region. So that's good. They're not the posture is a little bit better that way. The arm and wrist posture has been improved because in this case the laptop is not sitting directly on the student's lap and therefore angled downward. It's sitting on a 3-ring binder so that you kind of, despite the fact that your lap naturally angles downward, this is being designed against, and now the keyboard is not angled downward, it's more or less straight, and so the arm and wrist posture is pretty good. But as you can see, the head and neck posture, still not ideal. You're still looking down at the monitor pretty severely, and that's you're either going to hang your head and get neck pain, or you're going to get eye strain from looking downward for a long period of time. So better, but still not ideal. The 2 pictures on the right are kind of what you want to focus on for using your laptop. And really the next picture over, that's the best thing you can do. Use peripherals if you have them. A peripheral mouse and a peripheral keyboard makes all the difference. And then once you have those and you have them down at a correct location on a desktop where your chair is put in a position where you're not having any strain on your shoulders or your wrists or your elbows, then you can just use whatever you have handy to put the laptop up to the right height so that the monitor height is correct. Again, you have to have a peripheral keyboard and mouse to make this work, and I know that peripheral ports are sometimes at a premium on a laptop, especially if you don't have a docking station, but it really is worth it to use them if you have the means to do so. If you cannot use peripherals, if you just have strictly the hinged laptop and nothing else, then what you can do is what you see on the far right, where you use lumbar support, you kind of lean backward slightly, and you angle you prop your feet up and sort of angle your legs in such a place that you can you can set the laptop in your lap, but the keyboard it's angled downward a little bit, but because you're leaning backward, it's not quite as severe as it is in like picture number 1. So in this case, you've got it's still not a perfect wrist posture or neck posture, but it's better. And if you can't use peripherals, this is really the ideal way of trying to use a laptop. But regardless of the way that you use a laptop, the important thing is to take frequent breaks. Listen to your body when it appears that you need to change your posture for a little bit. You have a separate video that you're going to watch by Dr. Gooden about biomechanics. But I'm just going to give you a quick note about biomechanics in response to the Thompson et al. Article that you had to read in this module. One of the major risk factors for anterior cruciate ligament or ACL injuries is what's called knee valgus. This means that your knee bends inwardly. You see the picture there on the right shows a knee valgus. Now, knee valgus occurs a lot of times when you're running and you suddenly cut and change directions, which is something that happens a lot when you play football, or also known as soccer. So the subjects of the Thompson Research Group study were female soccer athletes ages 10 to 12, and the intervention group in this study received the FIFA-certified warm-up program for injury prevention to try to reduce ACL injuries. The control group just did normal stretching before their matches. What was found was a significant reduction in what's called knee valgus, in other words, at the angle of knee bend, when double leg jump exercise activities were done by these female soccer athlete subjects. What was found, though, is that, yeah, that's fine, but what happens a lot of times when you're actually playing a game is that you do unexpected cutting and jumping in response to where the ball is or where your opponent is. And it was found that for unexpected cutting and jumping, that there remained a significant risk factor for ACL injuries, and that the FIFA certified warm-up program did not really reduce the number of ACL injuries in the intervention group. So, it's biomechanics is a complex topic, and that's why I didn't want to address it on my own. I left it to the expertise of Dr. Gooden to handle that. So in summary about ergonomics, ergonomic injuries are a significant and likely underreported source of injury, pain, and suffering. Again, what we're talking about is when we have a poor fit between a person and a task. Ergonomic injuries can interfere with a person's work life, their personal life, and their hobbies and interests. While generally people don't die of them, sometimes ergonomic injuries have sort of led people on a downward spiral that led to death by suicide or by overdose because of opioid addiction. So they do cause a lot of harm and a lot of suffering, and there's something that we need to address. The primary risk factors for ergonomic injuries are excessive forces, vibrations, repetitious activities, awkward postures, and contact stress. The good thing is there's a lot of tools available to us to prevent and mitigate ergonomic injuries. A modified version of the hierarchy of controls can apply to the prevention and mitigation of ergonomic injuries. So that's it for this week. Let me know if you have any questions or concerns. Thanks for your attention.